Hello, how are you? Welcome to our second part on long-term complications of female genital mutilation and their management. My name is Winnie Barawa. If you're new here, this channel focuses on lessons, lectures, and expert interviews relating to healthcare. Now, this session on FGM, or rather female genital mutilation, is supported by the Girl Generation in collaboration with ACAF and the University of Nairobi. So this is a project in partnership that works to end the practice of female genital mutilation in our community. And if you've not been following this series, you can check out the first lessons we did in the playlist of gender and sexuality. So keep up with me as we move forward. Please, again, if you've not subscribed, please remember to do so. Leave a comment, and also you can join our community so that you can get members only tailored content for you. And don't forget to leave super thanks to help us support our work and bringing you videos on a continuous basis. So on the long-term complications, we've already started in part 1 where we talked about the issue of chronic pain, the issue of working around urination or difficulty in urination. Now in this class, we are going to focus on menstrual problems, the epidermal cysts and the keloids, and how both of them can be managed. Epidermal incision cyst in the genital area. This is illustrated where we say sometimes the external layers of the skin, which is the epidermis, can become trapped in the deeper layers, that is in the dermis. This what leads to what we call the epidermal incision cyst. So this cyst, while the trapping of the epidermis is happening, it can lead now to the increase in size, or rather it can grow and increase in size until it becomes big. So in other words, it's like an inverted skin layer or an inversion of the skin tissues. So the epidermis ends up being trapped in the inner layers. Now, while this happens, it can cause to swelling. More so, this could be due to inflammation. So you're told that the cyst can sometimes become inflamed and infected, resulting to pain and tenderness. So if the epidermal incision cyst is located in the genital area, it can really cause a lot of pain and discomfort during sexual intercourse, and there's a possible chance of obstruction of the opening or the vaginal opening during childbirth. So remember, this lady has gone through FGM, and we're not sure which one she's gone through, but assumedly she has gone through female genital mutilation type 3. So in this case, we are aware that there's an influence or an effect and a damage that has been done on literally on all the parts of her external genitalia. So I'm being explained that when the epidermal inclusion cyst develops, it tends to grow in size, or it increases in size due to the inflammation. And even as it grows, it can still get infected with microorganisms. It's also going to lead to pain, but also it's a very tender space. So with a lady who's has undergone through FGM, and possibly she is also experiencing childbirth, with that particular obstruction, it can lead to pain, it can lead to obstructed labor and other childbirth-related complications. But then you need to talk about image, because some women may not feel happy with the appearance of their vaginal areas with the experience of having an epidermal inclusion cyst. So with this, it's going to affect several things. So number one, you need to remember there's an image distortion here, or there's a change in the image, and then there's an aspect of obstruction of the vaginal opening, and then there's pain, there's tenderness, and there's risk of infection. So this is what the cyst does. So in this picture, we are having an illustration of how an epidermal cyst can look like. And you're told when this keeps on, it can now start enlarging and becoming tender, and it can grow until we end up with some obstruction around our vaginal opening. So this here shows us in clarity how it can look like. So as you can see, these are the various obstruction or growth that is initiated here. And then this photo shows you the growth and the increment in size. And as you can see, this is on the lower side of the vaginal wall. So it's more like growing, heading to the upper side. Then as you see, there's one that has grown on the upper side also. So this is a zoomed view of it, but then you can see like this one, which is under the speculum. This is on the upper wall of the vaginal wall, so it's coming downwards and trying to occupy most parts of the vaginal opening. So the cyst basically shows you the growth and the enlargement that can happen when the epidermis gets inflamed or the epidermal layer gets to be trapped in the dermis layers. So here provides the management of the inclusion cyst. So the first beginning part of any management is taking good medical history, and then you need to go in and perform a genital examination. This is to help you establish the location of the cyst. You'll be able to establish the size of the cyst, and then you can also inspect the woman's genitalia for any other aspects that you need to know. And in this case, you can examine the size and the location of the cyst. If you suspect that the cyst has some abscess, you can just perform what we call incision and drainage and be able to remove the cyst. Of course, after removing the abscess, you need to understand to initiate antibiotic management or antiseptic management so that the woman can be free from further infection, and you can also facilitate proper healing of the area. So if the cyst does not represent a potential obstruction, or you're not worried that it can cause other difficulties like tenderness and pain during sexual intercourse, you can explain it to the patient that you can leave it undisturbed. However, you need to always check out for further complications, in the cases of pain, the cases of obstruction, because remember, this is a risk that it can also be growing, and you do not want to risk the case of obstruction. Number 5 part of the complication is menstrual difficulties, and this can happen in different forms. It can come in form of dysmenorrhea, which is defined as difficult in passing menstrual blood, but also the client can develop hematocolpos and hematometra. These are types of menstrual disorders that deal with the accumulation of blood in the vagina and accumulation of blood in the uterus, respectively. We shall expound on this in the next slides. So we are told that the possible cause of these menstrual difficulties may be due to the tight infibulation that was done to the lips, and it can also be due to the scarring that led to blocking and narrowing of the vaginal opening. The menstruation physiology is that the blood or the waste blood will flow out through the vaginal opening. Now in FGM, in the type 3 in specific, there is suturing of the lips. Now, when we suture the lips and wound healing happens, part of it can block or can obstruct the vaginal opening, or it can narrow it, making it difficult for the menstrual blood to come out. So a very narrow vaginal opening may not allow the normal menstruation flow, and this can result in the cases of dysmenorrhea, hematocolpus, and also the hematometra cases. So this will depend also with how narrow the vaginal opening is. Unfortunately, blood flow is usually affected by the speed, and we are told in cases where the speed of blood is very slow, then there is risk of thrombus or formation of thrombus and thrombosis responses. So in this case, the narrowing of this vaginal opening is what actually increases that risk of clots, and that's what mostly brings out these menstrual difficulties. So beginning with the hematocolpos cases. So hematocolpos is described as a medical condition in which the vagina is pulled with menstrual blood due to multiple factors which led to the blockage of the menstrual blood. So in metacolpos, we are worried about the blood accumulating in the vagina. So remember, when the menstrual blood gets out of the uterus, it's supposed to flow outside, and it's not supposed to be obstructed. However, if you obstruct the vaginal wall, then you're worried about blood clotting happening, and the menstrual blood will clot in here, causing the hematocolpos cases. But then we have the hematometra case, which is said to be accumulation of blood within the uterus. This is said to be common in puberty. Now, hematometra, this is where the blood now ends up blocked or ends up obstructed, and it accumulates in the uterus, so it's not able to come out via the cervix and the vagina and get out. So these are the complications that come out if FGM is done, and it leads to the blockage and obstructions of the vagina and the cervix. So if you block the cervix, you end up with the cases of hematometra because you will have blood accumulating in the uterus. And then if you have cases where the vagina at the end point is blocked, then you can have blood accumulating in the vagina portion leading to hematocolpos. So these are the possible chances that can happen if the channels are not open enough or they have ended up being obstructed. How do we manage menstrual difficulties? So in the management of menstrual difficulties, number one, you need to establish the menstrual disorder that you're dealing with. Is it dysmenorrhea? Is it the colpos? Is it the metrals? And once that has been done, then you can go for pelvic ultrasound to confirm the establishment of this disorder. You want to know where the clotting is happening, where the blood is accumulating before you can intervene. So they are being told that in clinical presentations or in clinical examination of the menstrual difficulties, you can sometimes palpate or you can have palpable suprapubic masses that could indicate to you that your client could be having hematocolpos. So in all this, it's just a way of establishing for you that there could be blood accumulated in the various parts of the reproductive system of the woman, and you would like to rule out that before you initiate any treatment or any management for this lady. Thank you so much for staying all the way to the end. Again, you can share this work with your platforms. Give it a like if it's a very good platform for you for learning. You can leave a comment and always remember to subscribe so that you can be part of our community and we can inform you when we post the next video. You can send super thanks or you can use super thanks to support our work. And you can also join our community so that you can be posting lessons on time.